Gilead was founded in 1987 and has been at the forefront of advancing the care of people with HIV since. When you think about the early days of the epidemic, patients were taking a handful of pills a couple times a day, as many as 50 pills per day. But look at where we are today when we have a single pill that it really helps you manage your condition and has really turned HIV from an acute infection into a chronic disease. So we've made tremendous progress over the last 40 years, and Gilead has been right in the forefront of those advances.
I was very fortunate to be able to be part of the scientific development of PrEP and worked on some of their early clinical trials that demonstrated that PrEP was effective. So I remember well the scientific endeavor, the huge scientific endeavor it took to demonstrate that PrEP was safe and effective for HIV prevention.
So PrEP Hub really came about out of the notion that there's still a lot of stigma when it comes to treating PrEP. So using technology to provide access to that care, to raise awareness about PrEP, and really provide the tools for consumers to get PrEP was really, really important to us. So we wanted to create almost like a digital navigator so that they could understand, what is PrEP? Do I need PrEP? Am I at risk? How do I find a PrEP-friendly physician? How do I find a PrEP-friendly pharmacy? How do I get HIV testing? How do I get the medicine potentially delivered to my home? And once we understood the barriers, we began to see themes, and we began to develop personas so that we could create a solution that fit the needs of those consumers.
And so PrEP Hub gives that entree to be able to have a discussion wherever they are across their spectrum, from I'm ready to use today to I haven't really even thought about this much yet, but tell me a little bit more.
PrEP Hub is a great website. It provides the information without having to search everywhere. Basically, the term hub means everything is in one place for you. So with PrEP Hub, individuals who are interested in PrEP can go in, put their information in, do the survey, and then they're connected, regardless of where they are in the country, to clinics and community-based organizations that can provide PrEP services. So I think tools like this gives a person the opportunity to pace themselves, to learn what they need to learn. And even if something happens while you're on PrEP and you want to know more, having a resource that actually gives you a guideline for what can be happening, I think that that's very important.
Our hope is that we can continue to galvanize the community in the rural areas where people truly need it the most, where we have the epicenter of the epidemic, and prevention is core to ending the epidemic for everybody, everywhere.
I think one of the important goals of PrEP Hub is particularly to be able to address disparities in PrEP use and to be able to provide tools to be able to make those connections easier for individuals in disproportionately affected, disproportionately burdened by HIV communities is particularly meaningful, because in order to be able to talk about ending this epidemic in a real way, we have to talk about really ending it for everybody.
So Gilead will always be committed to ending the epidemic for everybody, everywhere. And when we think about middle-income countries, low-income countries, even how we're conducting our clinical trials now, and there are some really good learnings from the pandemic, we are using technology to bridge the time between visits or to save people from having to come into the clinic for certain visits.
I'm looking forward to the future of better prevention, of global prevention, just like birth control pills. Whoever needs it can go and get it. That's where I see PrEP, just being completely accessible to anyone, and that within itself can assist in the eradication of it. Again, because if we're able to prevent it, we can kind of take it out.
I'm hopeful every day that we can end the HIV epidemic. And if we can come together as scientists and researchers and clinicians and community and civil society and advocates, that is where we have the potential to end the epidemic. Yes, I am optimistic every single day. It drives me forward.